So why it happens like that? I mean, at least my opinion. I mean, again, I just commented things which I managed to collect, yeah, and now I can also share my opinion and the logical outcomes which I managed to get, also based on another, let's say, talks. Of course, a bunch of things could be rejected. You can easily also, like Google, I basically gonna give you ground for thinking, for researching, or at least to bring you on the same, let's say, side to understand how internally a healthcare system works in Germany. So why it happens like that, my opinion. Let's again make a step backwards. To understand the picture, you sometimes need to make a step back. So, types of healthcare providers in Germany. First, hospitals. So they have separate regulations, they have separate financial or financing processes, and they kind of special, let's call it like that. So we will not consider them, I will not reject them, let's say, too much or too carefully. Very big hospitals are known, for example, Charité, so on. Like there is a big pile of actually big hospitals and concerns which are purely specialized on that. And yeah, they have also sometimes very good and strong Weiterbildung programs, so on, but it's super hard to get there. And yeah, they also burning actually. There is a lot of patients running there, but they are special, let's call it like that. Second part is municipal practices. That's exactly this target audience, which is I try to cover during this talk. So those guys are require special KV permit for practicing. They are kind of private organizations, so they can be owned by the, let's say, the person who is a doctor, or some kind of, let's say, small group of the doctors, for example, KV-Sitz, so on, could be in place. So basically, it's kind of small units. Or municipal practices, which allows to let's say treat patients, also do some surgeries, things like that. So they sometimes have full spectrum of the coverage. So they can treat literally anything if they do it, if they want to do it. And private practices, really private ones. Why I just named them? Because first they have different conditions. They do not work with KV, so they don't work with public insurance at all. They just, in most cases, rather need generic doctor registration, some base things to be able to operate or to be operational, and that's it. So, main difference for you to fill up. Municipal practice, they have access to the public insurance, and public insurance dictate them how to work, and they, like public insurance, let's say KV, gives them special permit for doing it. Then, of course, etc. There could be some additional variations, but doesn't make sense to mention right now. Most of the doctors right now practice in the municipal practices, so it's Arztpraxen or KV-Sitz, or just praxis, or hospitals, which is just Krankenhäuser. Then let's talk things which I mentioned. KV. Kassenärztliche Vereinigung. KV. Simpler. It's Association of Statutory Health Insurance Physicians. So, a public corporation, and they are subject of the supervision of the highest administrative authorities of the states or federations, responsible for social insurance. So, simple. I mean, just organization and association of the public insurances, in simple words. Ärztekammer also was mentioned. So, what is Ärztekammer? Is basically it's a medical association. So, their core task is further medical education for the doctors, training, professional law, quality assurance, and training of medical assistants. They basically grant further authorizations for following medical training, and they organize and carry out examinations. Simple so far. Now let's talk, as I also mentioned, about KV-Sitz. what is KV-Sitz? So basically, Public Health Association provides the practice to like a permit to operate, to work, so, or license, if you can name it like that. Amount of these permits is limited and defined by KV. To be frank, I didn't manage to find out that well. What are the rule of thumb they're using to say that, okay, this amount of permits is enough to serve particular area. I didn't manage to find. Maybe like if would make more deeper research, of course would manage, but so far I didn't try really to focus that much on that. So far it's enough to understand that amount of permits is limited and dictated by some conditions known to the KV, and permit is named KV-Sitz. KV-Sitz have two different types, if we can name it like that. It's not really types, but kind of. First one, KV permit allows to do the surgery workloads. Second one, it permit allows to do the conservative workloads. It doesn't mean that you cannot do, for example, with one permit something else. You can do, for example, if you have just conservative KV-Sitz, you still can do the operations. But there will be some issues with that. Which issues? If we talk about surgery KV-Sitz, surgery KV-Sitz provides the possibility to make invoicing for the surgeries, and it has no any bonus for making conservative manipulations. Simple so far. KV for conservative workloads, as opposite, it has some bonuses for the practices which allows or which do not perform any operational treatments, or at least which are not billed through the KV, through the public insurance. So privately might be okay, but through the KV, through the insurance, it's not allowed. And this exactly brings sometimes the issue. So step back. Why this bonus appeared? The initial assumption was that as soon as a praxis doesn't perform any surgeries, it earns less money. Logical, completely correct statement. And as soon as there is still quite a lot of conservative practices, there was, I think, a decision at some point to make additional bonus per each patient in the quarter, which appears in this conservative praxis, to let's say to the practice itself. So this bonus basically paid for each of them. It's not that big, but it's still money. And of course, in case if praxis who was initially doing only conservative workloads and got those bonuses for each patient, and then they decided to make at some point surgery, this could lead to the issue that this practice would have to return back that bonuses which were paid, so there could be some issues, so potentially money loss, which is not wished and in most cases not really welcome. That's why there is strict separation, I would tell, in most cases, in all the practices which you can find in Germany. So this is KV-Sitz for the operations, and this is KV-Sitz for the conservative workloads. They do not mix it up. What is KV-Sitz in general? What it defines and regulates? In a few words, I mean, I don't want to go way too deep into details, but basically they regulate type of the actions which doctor can perform and how to get compensation for that, or invoicing, if we can name it like that, and send it to basically to this statutory health insurance, so to public health insurance. Then minimum amount of hours which doctor must work, so which doctor must be available for the patient, not just present on the working place but actually be available. Then maximum amount of patients which can pass through this doctor per quarter. In case if, for example, I don't limit, for example, 800 different patients per quarter, if in case if doctor, for example, receive 1,000, then 200 not gonna be paid. So difference not gonna be paid on top. That's why for the praxis itself, as a praxis owner, makes no sense to work more, because you will not get paid for that. Just literally makes no sense. There are some exempts, of course, from this, for example, numbers, like from this limit. For example, some urgent cases, and it's actually, there was the special Dienststelle, also created by KV, as an answer on the complaints from the patient. The reason is, or like the background story, that in Germany here, as I mentioned, very, very hard to get the appointment to the doctor. And I mean, it doesn't mean that people are still don't need any treatment. They really need the treatment, and they start to complain too much. So what was the decision? That KV decided to make special call center where you can call, says, yes, now I'm acute, I have an urgent case, and now I need the treatment. And they just send you to particular praxis, and they just obligate every praxis who is in this KV, let's say, who has or owns KV-Sitz, that they need to receive this patient or defined amount of patients per quarter as well. And of course they pay on the top for that. So this is kind of exempt from these numbers. And yeah, in this case they just assign a person and pay on the top for that. So it's another, let's say, reason for the praxis why not to get a new patient, because they will come as acute through this KV Dienst or through this KV call center, and you'll get money. That's it. Then another, KV-Sitz also regulates the location where you can open or the praxis, or where you can work. So you cannot, for example, say, okay, I'm gonna take the KV-Sitz in, I don't know, Berlin, for example, or Hamburg, or any other location, and then I just open any place where I want in the city. No, they have some kind of locations, and they said, okay, here in this location particular, for example, we want to have only 100 permits KV-Sitz. And this 100 is just stays as a constant. So just if it's already, let's say, occupied by another praxis, then no free space anymore. So you cannot open anymore, but maybe somewhere else available. So this is how they somehow try to redistribute the permits across the cities, across the country, to be able to somehow ensure that all the doctors not centralized in one location. Idea is good, but so far not clear how actually it's regulated, to be frank. Also, KV-Sitz requires or regulates and provides actually the duty to make the duties after work, for example, overnight or weekends for the urgent cases. So there is like kind of schedule, and doctors have to, let's say, sign on that they're gonna be, for example, on the schedule in particular location to be able to receive these patients, or they are available also through the call or through the phone, so on. So kind of there is a pile of regulations what needs to be fulfilled. And similar to what is or what was relevant to the patient, like when you have just the public insurance, same for the doctor who works with public insurance, with the KV, their requirements and the coverage can change just through the law. So there is like pushed the change, and now you have to follow. So if, for example, wished by KV through the regulation that you must work additional, let's say, 10 hours, you have to work because you have this KV-Sitz, so you have obligations in front of KV. Separation of KV-Sitz types makes doctors to be on either stationary conveyor or surgery conveyor. Well, this is kind of self-explainable. So like if you choose either to be on the conservative, or if you decide to be on the surgery, then yeah, you kind of either here or there. You can be both here and there. It's pretty much hard to do. which basically brings us to a situation when you have half of a doctor here and half of a doctor here. I mean, technically, a good doctor needs to be able to make a surgeries. This doctor needs to also treat the patient after the surgery, because he sees then how surgery, after surgery, how patient recovers. It also does the clarification for the patient before surgery goes. So kind of it's full, let's say, a cycle handled by one doctor. This is kind of logical expectation. But in the current reality, because of this split, you have half a doctor, like one part is operating, another part is actually doing all the rest, and sometimes they even don't communicate too much with each other. That's why I name it half a doctor here and half there. And technically, as a patient, you don't want to be treated by half of a doctor. So it sometimes brings kind of strange cases. But yeah, anyway. You cannot be a really good professional if you cannot combine both, but you cannot combine both because the system doesn't allow you. Splitting of the doctors by KV per mid types. A problem of the ambulatory medicine base. So let's go. What does the employers require from the employees who have the conservative KV-Sitz? They need just to take high amount of patient, 3-5 per minute. No, kidding. One patient per 3-5 minutes. This is already considered as a normal in some areas, which is not actually good for patient at the end, but I mean, you would tell, yeah, it's not that much. I mean, 3-5 per minute per patient is not too much, but over the day it's around 80 to 100 patients, and each of them you need to understand what is happening with it, why, and provide proper treatment on the one side, and on the other side, if you just didn't manage to do it properly, you also have kind of legal issues potentially, because patient also can go to the court afterwards and things like that, because they didn't get the normal treatment. Also, this conservative doctor, he needs to fill up the papers for KV, because a lot of practices, they don't want, let's say, to allow, for example, to nurses or some kind of supportive personnel to do this type of the workloads. So they put this workload to the doctor. Yeah, doctor did it, so why not to fill up shit tons of the numbers in the correct sequences, and then afterwards even ask why you forgot to put here or there some number, because it helped us to make more money, for example. So, conservative doctor also needs to explain the surgery process. So, if, for example, doctor sees that, okay, this patient needs the surgery, then it also needs afterwards to make this Aufklärung process, to explain the patient how it goes, what are the negative aspects might be, answer the questions from the patient, and things like that. And now just imagine, you need to squeeze it into 3-5 minutes. It's impossible, literally. Like, just put yourself as a patient. You need to have, I don't know, operation. Of course, you would have a lot of questions. What to do, what to expect, blah, 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 blah. There's a lot. And yeah, the conservative doctor needs to do it. Unfortunately, and this is reality, especially in some of the subspecializations, is that doctors also need to sell the sometimes even unnecessary manipulations or surgeries, which might be just paid extra. Of course, it's very hard to check at the end what is misusage of the system and what is was okay-ish. But the reality is that, yeah, in most cases, employers require the employees to improve money flow and to sell particular things which are not mandatory. Doctor also in this case need to deal, doctor who is on the conservative KV-Sitz also need to deal with post-operative checkups. So, like, whatever was done during the surgery, this doctor then afterwards need to take a look if there are any complications, if it's possible to handle in the conservative way. If no, then again send it backwards to the surgery doctor, or worst case send it to the hospital, because this conservative doctor doesn't know anymore, or not conservative, but surgery doctor doesn't know anymore how to handle this particular complication. And yeah, as you see, there is kind of a lot of things to do. Also, the biggest headache here, and this is what I hear very often from the doctors, that conservative doctor in many cases needs to handle unhappiness from the patients, so resolve the conflicts, and this is sometimes very, very, very hard to do. I mean, like mentally hard. Also on the top, of course, cover incompetent nurse workloads, reduce some measurements, double check if measurement was made correctly, so on, because sometimes people just, or nurses for example, they just say that, yeah, it's not my duty to do it, or I just don't want to do it. And if you don't like something, just fire me. Good luck, because firing is also not that easy process in Germany, but different story. And of course, yeah, as was mentioned, handle complications after surgeries and many other duties. If employer have the surgery KV-Sitz or KV-Sitz for surgeries, and if it doesn't do it on its own and just hire someone for doing it, then what are the requirements? Handle high amount of surgeries, the most critical requirement. And if there is gonna be any kind of free time available from the surgeries, then might also support conservative doctor, which is in most cases never happens, because usually the price for the surgery KV, now for example for the Sitz itself, is higher, and also it's also not that cheap to keep, for example, operation working and the nurses around, so on, so it's usually more expensive. That's why they usually try to make 100% load on the surgery doctor, or just reduce its working hours, and all the rest workloads move to the conservative doctors. Usually demand or requirement from the employers, doesn't matter which, like conservative or surgery positions you take, is to be 100% of time or working time by employed doctors must be dedicated exclusively to handle patient flows, or either surgical or conservative. And in this case, from employer point of view, overtimes are okay. The lunch times might be shifted when it's needed, skipped or shortened, even if it's, let's say, not fitting actually to German regulation and law regarding the work, let's say. So there's some kind of regulations, and even this one sometimes might be violated. And even consulting with colleagues sometimes not really assumed. So doctor just to be isolated unit who just works on the conveyor of the patients. It's basically a phrase of one of the doctors who was in conservative practicing for like more than 6 years in different locations, not even in one.